welcome to our fifth episode of Public Health One-on-One. My name is Parth, and today we have with us Patralekha Chatterjee ma'am, who is a journalist, who is a public policy analyst, and she has worked majorly in the field of public health and also development, which she'll also mention her interests. But today we have her here with the main agenda to discuss, is health a political issue? Something which we have been realizing over the past few years. And today we are going to mainly talk about that. So thanks a lot, Patralekha ma'am, for joining us today.
Hi,
And
Parth, and you don't have to call me ma'am. Patralekha will do as well because I believe in equity and non-hierarchy. So I think, and I'm also of the generation of journalists who I entered this profession in the 1980s, where we never addressed anybody as sir or ma'am in the newsroom. So I'm quite comfortable with if you call me Patralekha, I'll call you Parth. So
okay, sure.
yeah, so great to be here.
Like I have given a very brief introduction about you. Why don't you just tell us something about yourself and we can get started?
I'm not a very interesting person, so I don't really want to talk about myself. But maybe I can talk about my work. As through your questions, yes, I have been in the profession for over 30 years, and I have reported for actually more than 20 countries on not just on health and development. I started out as a crime reporter,
Okay.
so with definitely no intentions of changing the world. And I came to development actually gradually. I wouldn't say it's not like I, always wanted to be a health. I think at least after a decade of reporting on politics, on foreign policy, on a whole range of issues, crime, strategic issues. So it's by choice. I came to development and health. And actually, I would say a lot of the work I have done for the Lancet, British Medical Journal, World Health Organization, and also a whole lot of books, book-length monographs, actually, for various UN agencies, particularly UNICEF and also UNDP, UNAIDS. I would say I started out as they just picked me up as a journalist who could write and who knew something about development, not necessarily know much about, say, HIV/AIDS, which I've covered right from its onset, early 90s. And it is the exposure, which you never get actually as a journalist. When I wrote these, 300, 400 page books and long reports, and when I could, when unlike a journalist, I could spend entire days, weeks with one person, two persons, and long conversations with doctors, with nurses, with caregivers. To me, that exposure, as I said, I didn't start out as a health journalist, but when I had that exposure, I really got interested in this issue, and I would say I sort of figured out, HIV/AIDS was, I would say, one of my major entry points into this whole public health. I would say in the early years, when there was massive stigma, when everybody was not getting antiretroviral medicines, and your issue about why it's a political issue, we'll come to that later. So that actually showed me a lot. And this was not just in India. I did a book on an initiative called GIPA, Greater Involvement of People Living with HIV/AIDS. I don't think HIV/AIDS is not really so much on the radar now. And this was, you could say, one of the slogans coined by UN. But because I was a journalist, basically, and by temperament, I would say, and not a typical consultant, I had longer conversations with each of those people living with HIV than was warranted or than was required to do a 100-page thing. That was on my own time, on my own energy. They all became friends. And I'll just tell you a little story. And that showed me, I've gone on to teach health and environmental and, development journalism to undergraduates and also postgraduates, also trained journalists in India and also across the world, and also done manuals, etc., on various issues, not just health. The whole issue of power and powerlessness. So I am talking about the 90s, and when the HIV moved, it was a big issue, and there were like 2.5 million people living with HIV. There was all this debate about whether India's AIDS HIV figures are actually correct or not. But I was sitting in one of the UN offices doing these various booklets, and I can share links with you later on also trafficking HIV, and I was talking to people living with HIV. I was attending various workshops ostensibly to document some of just the workshop and incorporate some of the insights into these booklet stuff that I was doing. But I wasn't just attending a workshop. I was having conversations during lunch, during dinner, during break, and subsequently, and I'll tell you one story. So it's these two narratives about what was being discussed, let's say, at the meta narrative about what was HIV, and the people's realities. I remember this story so well. This man is actually no more. He was a guy from Nagaland. He was living with HIV. He used to sit opposite me as a consultant. I was sitting in one of the offices, and one of the offices of an UN agency, and I was sitting opposite him, and I said, okay, let's not name him, whatever. Let us say Mr. John. His name is not John, but he was from one of the northeastern states, I think Nagaland. And I said, so tell me about what GPA feels like or whatever. And he said, but how can I talk about GPA when I don't have a place to stay right now? My landlord is kind of chucking me out because I have this stigma. There were people who, if they do you remember that there were times when it was criminalized, so even being a gay and things like that, right? So there was all this stigma around these issues. So he said, so these big issues, big slogans, and he said, I don't have a place to stay. My worry is about that, so some of these issues, what is your life? Who's this human being? And the very first person I met who was living with HIV AIDS, I still remember, it was a guy, actually, he's a great friend, Lun Gangte, and I don't know, I hope, he's listening in at some point. So he's from Northeast, and he's a very, very cool guy. I mean, a very cool guy. So I went to meet him. At that time, I knew nothing about HIV, or very little, beyond what everybody knows who reads newspapers. And it was for a World AIDS Day article for an Australian online, publication. And they wanted something about living with HIV. So I went to this hospice. It was called Michael's Care Home. Yes, I think in Nebsarai. I don't know whether it still exists. And so I went, it was one of the few, and I realized one thing. NGOs who worked with HIV, very often they didn't want you to meet the people living with HIV. They would say they would talk on behalf, or they would sit in these conversations. So, I knocked on the doors of many NGOs and all that, and they all were extremely, I thought, proprietorial about these people. So I said, look, I, as a journalist, I'm not going to do anything which will harm these people. But on the other hand, I don't want a mediated dialogue. I want to know. So I went to Michael's hospice because they were the only ones who said, this was in Delhi, that you can go and talk to them. If they want to talk to you, we have nothing, but they should want to talk to you, and, informed consent and all that. So I walked in, and the first guy I met was this Loon. He was sitting over there. He had all these posters of Elvis Presley and rock star, and he was playing a guitar. And he said, what do you want? So I said, I've come to do this story, and I want to talk to you, and I want to talk to other people. He said, yeah, okay. But he said, do you see me? He said, what if I tell you? He said, what's your idea of people living with HIV? So I said, so before I could answer, he said, you think we're all going to drop down dead, right? So I said, no, not really. So he said, what if I tell you, you can drop down dead before me? They were already onto ARV. So I said, yeah, that can happen. So then he said, so you see me only as a person living with HIV? I said, no, not really. So he said, so you can interview me, you can talk to anybody, but as long, there was only one condition, you can even take photographs, which was like major news for me, that as long as you don't make us seem like victims. We're not victims. We are people living with HIV. We are not AIDS patients. It was a very profound insight, And he said, we are people living with HIV, just like there are people living with diabetes, there are people living with lots of things, but that is not our entirety. So the rest of the time we just spoke about Elvis Presley and the concerts and the football. And he says, we are playing with some embassy and we licked them last week. We're going to, and we're going to have this concert, come and watch us. And he introduced me to a lot of people. He said, you cannot take pictures of people who are lying on the bed with maybe like a drip or something at that point, because that is again, reinforcing like carom. And then he gave me some pictures of, the football matches he's played with other people, non-HIV. And he says, do you know who's living with HIV in that picture? No. So to me, the reason why I'm narrating this story is to say that these were kind of insights you don't really pick up from books or, as part of your terms of contracted work. It is because I genuinely found these people interesting. It was not like I was asked, we spent like the whole evening, we had a meal, and this song, I sang along. And I've gone on to so many of their functions later on. Loon, of course, is a major figure now in the treatment movement, here whole of Asia. He's still there, Loon Gangte. So it's just one of those insights about, how you give yourselves power. And I've seen Loon and many other people. I attended many his workshops and conferences where they've got up and they say, don't say AIDS patients, don't treat us like victims, don't say we are sinners, like how did you get AIDS, what was the reason, so to me it's extremely important. Right now I work as a opinion columnist, and that the general impression of columnists that they are armchair people, they're just sitting in the chair and writing. Of course you do that. I mean, I'm also much older, so maybe I can not do as much field work as I used to do 20-30 years ago, but I think it's extremely important still to go to the field, talk to people beyond conference paper. You do all that, read medical journals, all that, but you have to talk to people because you'll always get an insight about their condition, about what is health, what is so that's the brief intro. I don't think I have to talk very much more about my life. You can ask questions, and if it's relevant I'll tell you, but this is just the intro into my thing about health and why this is, I thought, was a very important issue. Because what the HIV, the interaction with these people told me, as I said, power, equity, powerlessness. How do the AIDS activism, during COVID, actually, I wrote, I think, a piece saying AIDS activists can teach all other activists a lesson or two. They had to struggle very hard, because remember, HIV, when it in the world, it started, it was visibilized in the West, right, in the United States. It started with gays, and I mean, the initial group, and they were rich, Hollywood, many people. But in India, that wasn't the case. It wasn't an influential section, which it was ordinary people. The first person was actually a sex worker in Chennai in 1986, right? So in India, the narrative of HIV has a lot to do with powerlessness. Who got it? How? It when you get into, and that's why I've written like several books on this. To me, you address vulnerability. You don't address just HIV, because if you see the whole story through the lens of vulnerability, you will understand everything. Why they got it, why did other people not get it, the access to treatment, access to everything, knowledge, the gender differentials. So it's about power, it's about power. Yeah.
So you have sort of worked in this field for almost 3 to 4 decades.
3 decades, like you mentioned,
yeah. 3 decades. And like you mentioned, inequity has been a major, like a center point in healthcare. Initially, it was globally, and now...
I'm sorry, I couldn't hear.
Inequity has been a center point in
huge,
health.
Huge.
And, over the years, what have you noticed? Is it getting better? Is it getting worse? What is the current status, as to say, globally and in India?
Well, I mean, inequity's always been there. It's not new, right? Mm-hmm. The thing is that health, what I'll answer the questions a little bit thing now. A lot of people think, when I entered this thing writing about health, the general perception about health, the sector as well as the writing about it, is that it's a soft subject and it's not really political. One of the things you will constantly hear, journalists to say, I write on politics. I don't write on these soft subjects like health and education. And now that's where, because my exposure, my experience with this issue has been actually not just as a journalist, as I said, though my journalistic writings also helped me a lot. But maybe as a journalist, if I was just doing news reporting, I wouldn't have been able to spend so much time with these issues, with these people, because you have to come back. You don't get 1 month, with you don't go back again and again and again, right? um, I think it is political because it is about inequity. What is, I mean, public health is extremely political, because it tells you how resources are allocated, who gets what. I mean, you take something like maternal deaths in this country. I've written a book on that also, Mapedir for UNICEF. I mean, I was the principal writer. Now, I wrote it soon after actually I had a child. I mean, a few years after I had a child myself. And to me, the contrast, like, okay, I'm a middle class person. I didn't go to a very fancy hospital, but just across the road where I live, there is a hospital which is 5577 star or whatever you call it. They're talking about 200 channels on the TV. So, and it's got some fancy French name. The thing is, so that's one. So when you look at maternal death statistics as a citizen, not just as a journalist, it's not just the numbers of, this many people died and this many, but who died and why and where. So when I did this book, Maternal, what we did is I was sitting in, because again, as I said, as a non-journalist, I mean, as a journalist, you don't get this kind of access. You actually sitting on these district, discussions, and you talk about, they were doing a verbal autopsy, so what is the reason? There was a lot of resistance from various local administrations not to go into the three reasons for delay, the three delays. You of course, this. What they wanted was the medical jargon for it. So let us say you are in Orissa, okay, in a tribal belt. And I've been to some of the extremely remote areas where I've seen most of the children are with grade 4 malnutrition, and the women are routinely, they're losing babies, or the mothers are dying. Now you go in over there, if you see, like, if you want to get the statistics about maternal deaths, what you will get is, typically from the official side, they will say that the woman died of eclampsia or hemorrhage. Now that doesn't tell you the full story. The story is that this woman, and this is where your entire social fault lines come in, and that's something, vulnerability. Why did this woman die? Or is, had a morbidity, and why is it someone like me? And I talk from a position of privilege, and I've been saying a lot that one must acknowledge one's privilege. I'm not saying, I'm not apologetic about it, but I am definitely aware of it, and I'm going to put it right on the table. Why is it that someone like me or any of my friends, anything can happen anytime? I'm not saying we're completely at far lesser risk of dying than that woman. And I'll tell you why. One reason, if you go into the three reasons, the woman, when she has let's say there's firstly, a tribal village in Orissa or UP or Bihar, probably the primary healthcare system is not functioning, right? So what does access to health mean? If you've got labor pains, you have to go somewhere. What is the other thing which is not there? The local transport. It's not there. It's not something which in village, if you've been to villages, remote villages, it's not something you just go to the street and you hail a cab. No. Yeah. Once a day, maybe you get a transport to the district hospital. It's probably 20, 30 kilometers off, or at least 10 kilometers off. And then somebody has to take you there, right? Now, what happens typically when I went into these stories, and this is exactly what official dumb, and I'm not saying it's about a specific government. No government wants this out, because then it's a kind of blame game which will start, In a family, let's say you have a potentially, a complicated situation. As a woman, you don't really have agency to say that, now take me to the hospital or I'm going. No. You're not even voicing that you have a problem. You keep it within yourself. You're tired, you're this, you're that. And I actually did a story for the Lancet many years ago, where I began by saying that it's not just about rich, poor. The poorest of the poor in India spend months planning for a wedding. People take time off. even the mazdoor, even the laborer planning for the daughter's wedding or for the sister's wedding or whoever's wedding. There's a lot of planning. There's a lot of money being kept away. Do they do that for a childbirth in the family? No, because it's seen as normal. Normal means the possibility of you know uh, complications arising is not even factored in. So when you live in a village where there's got no transport and you've got a woman who's pregnant and who's going to deliver, you have not thought about it. So a lot of the time goes among the three delays. What happens is there's a huge delay. Firstly, your primary health center is not working right, so you have to go to the district hospital just to get that person. I've done stories where when we're doing this stuff for UNICEF, ox carts and all these, and then the roads are also not there, like bumpy roads. I mean, there are some places like in West Bengal, I come across some panchayat, local action, they say there's a van, somebody has given. These are localized, there are initiatives. I'm not saying everything is bad. In South, there are very, very good stories about this ambulance. I think there's a number you dial and it comes, but they've got good roads. South is another planet, as you know. So you get there. Then you go over there. Sometimes even in a big hospital, there's not enough facility to take care of all the complications. If the doctor may not be there at that time, overnight, if it's late in the night, or if the doctor is there, the equipment is not there, or the blood is not there. I've been to what is it, community health center after community, where they say that there's nothing for cesarean. If you need a cesarean, there is no real facility. So then you are, and maybe the woman is bleeding. Maybe she's, and anyway, the chances of her being anemic is very high, as the vast majority. So then, you get in over there. Okay, let us say that you even, ashas and all have made a difference, institutional thing in some places. But let's say you even do that. But then there is a post birth. So again, you do not come and you don't have enough nutrition. Maybe then we go on to the next issue about why children are low birth weight and why they are malnourished, because the mother, she doesn't get proper care. Maybe after 6 days she's told, you go and fetch wood, or you do this and you do that. It happens in poorer areas, right? So all these multiple factors, what in academic jargon, what you call social determinants of health. Health is not just sui, dhaga, sui, and doctors. It is a whole story of social vulnerability. So what happens if when you have these multiple vulnerabilities, layer after layer, disadvantage on disadvantage, and of course the picture varies from state to state. You cannot compare Kerala and Tamil Nadu with, let's say, Bihar, right? But it's not that all poor states are doing badly. There are initiatives, localized initiatives. So that's what it is. So when I say that I'm unlikely to face all these issues, simply because I've planned for it. And even if I cannot afford a very fancy hospital, I've made sure that if in case there is blood, I've planned. Now that's because I'm relatively, I'm educated, I'm privileged, but the person over there, that woman, she has neither agency nor education nor resources, nor does the family think that all these issues are worth. It's not that they're ill meaning. It's just that it's never entered, it's never entered their head. So because of all this, so I'm saying, so there is an inequity. Now, the moment you talk about what needs to be done, then you get into the public health, the budget, the allocation. Will corporate hospitals solve this problem? No. So I mean, the issue is you get into a lot of the issues which we, especially in the middle class, don't want to talk about. They don't want to talk about that primarily because it doesn't affect us. Neither are we at risk, nor are our children at risk, right? By and large. I'm not saying we are totally risk-free. So I think inequity is an extremely important issue when you look at in a country like India, where we have first world standard healthcare system. You can get the best of healthcare at much cheaper cost than in the West, and that explains the whole story of medical tourism. And you have completely, I hate to use the word, but third world, third class, I mean, at AIMS or any of these hospitals, you see the fact that you don't have a primary health care functional is one of the easiest way to know that is to just go outside AIMS and see the number of people on pavements, right? Or outside any Safdarjung. Why are they there? Why is somebody coming from remote parts of UP to AIMS? Because their health system in the local area is not functioning. So I think these are all these issues. Now, over a period, we've normalized this. because the middle class has opted, as in education, we go to private hospitals, we go to private schools, we're not affected. And because it's we who have the voice and not this tribal woman in Orissa or wherever, the poor person. So the people who have the voice are numerically small, but the people who can make a noise, make a noise. So I think that's a very critical issue, that it's not their it's not their issue, so it gets sidelined, and why should you have so much thing on public health, health budgets and all that, because it isn't it doesn't become a real electoral issue, and even a lot of people don't perceive it. In fact, this conference I went to, I can go into it later, it was, they discussed this on why health in India, this is not the situation in every country. Thailand,
But
Sri
sort of to
Lanka.
just go back a bit and
Yeah,
like talk about what you mentioned.
yeah,
So it's very frank from your what you have told, that inequity is, it's a huge problem in India.
yeah.
But what is like state like Tamil Nadu or Kerala doing differently, which a state like Jharkhand or Bihar is not doing, in
Actually,
your
I think
experience?
Jharkhand, I have actually not been to Jharkhand, but I think Jharkhand and Chhattisgarh actually are, I think, taking some initiatives. I wouldn't say it's all bad over there. Orissa, definitely, you
Mm.
know. Um, you know, uh, Again, I don't live in Tamil Nadu or Kerala, but I think Kerala and Tamil Nadu are really from another. It's health. You have to see health as part of their larger context. It isn't only health that is good over there. It's education. It's everything. Infrastructure. They're much richer states, for one. And I think the main one critical issue is that they were genuine, and it goes. It's not just one political party or the other. They've been investing in people, human resources, and it goes back. I mean, in Kerala, it goes back, right from the Maharajas, and they were, enlightened Maharajas, missionaries, education, first state of literacy. Now they have a much, in my view, a much more. It's not perfect over there, but it's a much more demanding citizenry, a much more demanding people. So you can't fob people off with, people are going to ask questions, people are going to demand, and they're in a position to, I think education has a lot to do with that. Education and awareness. Why does it become a political issue? Midday meals were started in Tamil Nadu, right? Now, why did it, Tamil Nadu didn't have the worst nutrition situation. So why did somebody think of it as a political issue, and in fact, that is state, right? No matter who is there in power, they're not going to do away with it. Even Kerala has a good health system. I personally had, I was some time ago, I was on a holiday, and I had a direct brush with the Kerala health system. Actually, I had a dog bite, and I had to take a, and I must say that I was actually very happy that I was going to Kerala for a holiday and not some other state, because one thing I was very sure, I had to take my second and third dose in Kerala, that I knew that I would not find it difficult to get that. And straight from the airport, I drove to this hospital, Ernakulam Hospital. And, the doctor, I'll tell you what, a simple thing. So I had my first dose in Delhi and I had my papers, and I said, it was, I think, Rabivax or Rabipur, one of the two I had taken. And I said, this is what it is. I need to take the second dose now. He looked at it and he said, sorry, we don't have this particular vaccine, so can I give you another one? I said, look, I don't know whether it's compatible. So he said, okay, give me 20 minutes. So he made me sit perfectly, spotlessly clean air. It's not a fancy hospital. It's a private hospital. After 20 minutes, the nurse called me and he said, the doctor said you can have it because and the doctor spoke to me. He explained to me, he said, I've done the research. The WHO says that it's compatible, and it's an intramuscular injection, and both are intramuscular. So, and then he gave it. And then, even the third dose was in Kerala, I took it. So I'm saying this because he could have, I was a tourist, right? I was not in the neighborhood. He could have just given me something and, tair ho gaya, chala gaya. But the fact that he took that half an hour reading up research, and he felt it's important enough to tell me, about it. So I think there's a certain rights consciousness which has happened due to a whole range of factors. That I think helps. If people, you take also countries like, say, Thailand, the famous 30 baht health. I mean, it's legendary. Now, 30 baht, I don't know when exactly it was introduced, but whoever comes, that scheme stays. That scheme, so the universal healthcare, health and education, to me, are foundational building blocks, no matter what your aspirations are. So all successful market economies, most successful market economies, have realized that. They're not doing this because it's not loving the poor or anything. It's in complete self-interest. If you have healthy and it's an instrumentalist view, and I would argue that health is good because it is an end in itself. I mean, you should be a healthy person, not just because a healthy person makes a productive worker, but because as a human being. But there's also the other view, an instrumentalist view, that if you want a productive workforce, education and health basics, basic education and basic healthcare and basic nutrition are absolutely fundamental. And then we go into the whole malnutrition story in India, where, okay, ignore the various international indices if you want, but NFHS, what is National Health Survey telling you? What is CNNI? What is that Comprehensive Nutritional Survey telling you?
Yeah.
So, unless you want to junk every single national database, you are left with these, some very, very, I would say, uncomfortable facts about anemia, about undernutrition, about lack of dietary diversity. And when it happens to children, when they're very small, it affects the brain development, right? This is also, so I think there's a lot of gaps in knowledge and not enough push to, people are not seeing this connected with this other big story about, India should be a superpower and this and that. It's all connected.
Yeah.
Yeah.
So coming back to your expertise as a public health policy analyst and a journalist, what role do you play? Because social media has recently picked up a lot. You say something on Twitter and it goes viral, and everybody wants to discuss that with you. And so, what
Yeah.
role does a normal citizen, or a doctor like me, or a journalist like you, play in this whole context of, like, is health a political issue, and or what role does media in general play?
Well, I mean, one thing before I address any one question, I mean, I went to this conference, as I was telling you, on democracy, development, and health. And one of the things which was actually mentioned by Abhay Shukla, who's a very well known health activist, Jan Swasth Abhiyan, and he's based in Pune. So he said one of the questions was, is why health is a kind of becoming a political issue, but why is it not like the major make or break political issue, like, say, it's in the, sorry, UK or US, or Sujata Rao, the former health secretary, actually said something very interesting. She was in Canada and she said there was a particular town or somewhere where somebody, I think this became like the issue, about health, universal healthcare. So why is it not that? And Abhay had an interesting take on this. He said it's because the two major constituencies for health in India, that is the patients, those who are directly affected, and the doctors, they don't make it one. If you take the major doctors association, they don't, they're talking about, okay, salary increase, this, that, but public health, this is not their main issue. And neither are the patients, the sick, who are directly affected, and the catastrophic health expenditure, etc., despite all the health insurance schemes that way. So, and then why are they're not united? Are they united? They're not united. Why is it that such a lot of noise about NHS? The doctors, I mean, it's a huge issue, right? It's a top political issue in Britain right now. So why isn't in India, where the impact is much more, because people go into, I mean, in COVID time themselves, in the private sector, they were overcharging like hell, these ventilators. I know people like this, they went totally bankrupt. And even at the end, the guy died or something, This is before the vaccines and all came in, there was a whole lot of people. So it has always struck me that, why is this something which affects you much more than a temple or a monument or a whatever? Why don't we make the stuff which, forget about the poor, even someone like me, I'm not a government servant. So if I fall sick, and as I grow older, this really affects me. Insurance doesn't cover everything. Do I have health insurance? Medicines are not covered. where am I going to find money for everything if I live for another 20, 30 years? What am I going to do? I don't have a pension. I don't have family wealth. I don't have a rental income. What am I going to do? So if a middle class person like me is thinking, it will mean that I will not go for a lot of diagnostic checkups. I'm just saying that's the thing. And he said there's no solidarity between the doctors. Doctors, this is not their issue. They might make a few statements. They have not really taken this up as their major issue. The main doctors associations, I'm not saying doctors in general, um, they will bat for issues. It's more the healthcare industry, you know and I think some of the takes are not very nice, like clinical establishment act. Most of the doctors will argue against it. Lack of regulation. They don't want regulation in the private health sector, and even the patients. And he says this is lack of solidarity. And one of the this was just a speculation, so I talked to him and I said, but there are countries, and I actually thought to myself, countries which have done it, like Sri Lanka and Thailand. And generally the comment was, there was a lot of laughter with a lot of these experts, and he said they're Buddhist countries. And that is, then we get down to the real taboo subject in India, which is caste. Taboo by in the sense of in this discussion. So why do we not have social solidarity? It is because, in a village or in a social situation, if everybody who's affected cannot come together, and they do not come together because there are all these other fault lines. And even in something like healthcare, there can be poor Brahmins, there can be. So I think, I don't say this is the only issue, but somewhere the roadblocks to social solidarity building, whenever you see this word community, I'm very suspicious, because what does community mean in a village? We all know that the Dalits, for instance, live on the other side. What is a community? So when it comes to what is the job of the journalist or an analyst or a doctor, of course, our work, specific work, is different. So I think a doctor's primary job is not to write articles. You might write, or not to do podcasts, whereas a journalist's main thing is writing or speaking or taking photographs. So what I've tried to do, and I have columns actually, Dev 360, which is syndicated in Asian Age and Deccan Chronicle, and I also write for Amar Ujala and Deccan Herald, many other publications, and also my work in Lancet and BMJ and various publications. I try to make the connections, because I think one thing is, and I will tell you a little story about this, relates to my teaching avatar, but it's actually related. So I was teaching postgraduate students health and environmental journalism, and I remember the first day I came in, and it was like a 40 odd students, and there were a lot of people who were yawning, right? This is before I'd started. So I said, what happened? So they said, ma'am, some of them, not all, some of them said, ma'am, we're not interested in health. So I said, why? So they said, because we are like 23 or 22 or 24, we don't think we're going to fall seriously sick. And health, you're going to talk about doctors and hospitals and nurses, so it's not directly connected to our lives. Yeah, ye sab ghar mein agar koi, if somebody falls sick, there's a responsibility of parents. Agar grandfather falls sick, it isn't going to be a 22-year-old who's going to be tasked with organizing everything. It's going to be the father or the older. So I said, well, thank you for being frank. So I asked each one of them, so tell me, what are you interested in? Okay, you're not interested in, some of them said they're not interested in health. So somebody said economics, somebody said politics, somebody said fashion, somebody said society, somebody said finance. So I said, listen, so when I'm trying to teach health journalism, I definitely am not unrealistic enough to expect everybody to become a full-time health journalist, right? It's not going to happen. It's not necessary. But what is the problem in having health as an additional lens? Like, let's say, so I said, there's nothing, none of you have mentioned a subject which doesn't have a health angle. So it's also about making, so as a journalist, I find in my development, in my writing, I try to join the dots. Don't talk about isolated, like this one initiative or this one thing. How is it relevant to a whole lot of other things? So for instance, if you say that I'm interested in lifestyle, fashion, okay, I'm not judging you on whether that's the right choice or not. You're going to be a fashion reporter, fine. But is the fashion industry, is there health issues over here? For instance, all those supplements and those steroids which people take, is that skin bleaching? Is there health angle? If you're talking about, you cover foreign affairs, is there something called health security? We've seen this during COVID. Supply chain. If you say I cover politics, health as a political issue, why did Mr. Modi talk so much about Ayushman Bharat? So it's not like the most important issue, but there is an angle. And I try to explain to these students saying, it's like you're a photographer and you have many lenses. What's the problem in having one additional lens? So know something about health so that no matter what situation you are, whether you are in Jhumri Talaya, Johannesburg, or wherever, or Geneva, if you are aware of these issues, you will be able to get that one additional story and ask any questions. And so it's not, so I think health becomes more exciting, more lively, more relatable when you link it with all the other issues. And I think that's because, let's face it, a lot of people are not interested. The moment it becomes very sectoral, I know that as a columnist, I always have to, there is a problem. You cannot take up an issue and write, if I have a fortnightly column on something which seems very sectoral, because they will say, who will read it? This is not a specialized publication. Who will read it? Unless I link it with, I have to find that link and I have to find it. Don't expect the reader or the viewer to do all the thinking, So if I'm talking about anemia in a tribal area, I have to be able to make the link between why this is important. You're talking about India, skilled force, demographic dividend, this, that. Why is this important? It's 8% of our population, or is it 16? I don't know. 8% is Dalit. I don't know, whatever is the percentage. So I think you have to make these links. I personally see it as, I'm not saying it's always possible. Like when you're starting out as a reporter, I don't think, it also depends at what stage you are. You have to go and do your reporting. You can't do these large macro pieces or columns. That's not going to happen to you when you enter. That's fine. All of us, went step by step. We didn't get on to the top right away. But find out the links, even if you don't put it in a story that day. So if you have the understanding, I mean, I'm all for having conversations, going to the ground, wherever, whenever, even if you go on a drive, talk to people, if you're with the chai wala, whatever, talk to people, village, wherever, seize those opportunities, even in your everyday thing, talk to everybody whom you interact with, find out the, if you're, see, like my domestic helper, she's always got this, health issues. Her house was going to be demolished, Tughlakabad, and I went actually to her area and I found out. So if you're in an area where you think your home is going to be demolished, you don't have links to you don't have connections to water and stuff like that, do you expect a person to be healthy over there? So I think this social determinants, it's even doctors, that's what I was saying, that I think it should be extremely important, and it can be made fun. It's not like I said, my first conversation with Loon, I wasn't part of the Save the World Brigade. At that time, I still am not. I do this because I find it fun. I find it interesting. Having these conversations with young people like you or with other people, it's not part of, being some kind of Mother Teresa or something like that. No, it is, I genuinely enjoy these conversations, and it isn't also seeing the person as, here's this poor person. So it's not like you go and want to meet this poor person. No, I want to go and talk to the family of, let's say, Kalpana, who's my domestic helper. Now, Kalpana happens to be underprivileged, but there's a lot more to her. When I went to that area, I didn't actually go to her house, but I met a lot of people in these demolition sites. And the children, they want to study. They want to study. They want, they're doing homework. So you soak in all that. It's their dreams, their aspirations. They may be dancing to Pathan. So you will find all these bits and pieces. So you don't say, I want to meet a poor person. You want to meet a person. And that person's story has a lot of minuses, a lot of negatives, and also a lot of fun. It's not that poor people don't have fun. So I think the moment you take out these labels, you don't go and meet this Dalit person, or you don't go and meet this HIV person. don't put them in a slot and all your questions are, like as a woman, as a mother, very often when I go to a new city, a new country, and I talk to other women, I start talking about children, like your child, and you build that bridge, and then you can get into that person's immediate that circumstances, but that way to circumstances, like it was one of the lessons I learned from HIV, is that you definitely do not start with asking, how did you get HIV? Or tell me what it's like. Are you going to die soon? Or does it feel terrible? You do not start. You talk about it's a time intensive thing. You don't go with the pen and with 3 minutes and say, okay, tell me the questions. What's your answer? Are you going to die? When are you going to die? Are you feeling terrible? You, even if you've got 3 minutes, spend 1.5 about other things, nice sari, whatever. And there's no formula. You have to play it by the ear, then come to the situation. And if the person doesn't want to talk, respect that. Sometimes, let's say somebody's a rape survivor or a domestic violence, they may not want to talk about it at that point. You have to respect it. Go on to I'm extremely careful about that. I always play back quotes to people, whoever I interview. Is this okay with you? In many times they tell me, after they've initially agreed, no, we don't want, because you're scared. Fine. Because one thing, see, I have no delusions about journalists changing the world or anything like that. But at least, if you can help at least one person, I'm not saying that's my main incentive, but at least do no harm. I don't think any story is worth, if you actually, the person over there is going to be harmed by the exposure. You have to, and sometimes they're not aware. I've done stories on Swachh Bharat Abhiyan where people have, showed me out there, villages have no toilets and things. And actually, it was for the Lancet. And the Lancet desk person said, and I agree, that anonymize these people. Don't put any identity markers, because you have come back to Delhi. These people are over there. These are women, young women. You may put them, that the story, even though it's in a specialized journal, it could, if you identify the village, if you identify the person, who knows? So actually, sometimes some editors will not agree, but in this case, I really respected that, we came to the decision to anonymize, move away, leave the identity markers. You put enough details, but the person, nobody will be able to identify. I even put the district's name, but not the village, not the names of the specific people. So I think it's extremely important for journalists, it's not just health, any issue, when you're talking about something, because as I said, there is this power and powerlessness. The people, public health, if you're a serious public health analyst or a journalist, you will be talking mostly to the powerless, not the powerful. And you have to protect. The power and the powerless is not, if you have a balance, it's not the same. The powerless cannot negotiate with the powerful. You have to be able to understand what problems they could face and protect them, while doing your job. The story you write at the end of the podcast you do or whatever may or may not change anything. But the way I see it, even if it influences one person's thinking, or two persons or something, maybe not immediately, maybe after some time, I would, I don't have any illusions about the work I do or what a lot of us do, but I think I'm realistic. I do it primarily because I enjoy this, not to see myself as this grand, mover and shaker. I'm not famous or anything like that. But, and you should do it if you're genuinely interested. This is not something which is, it's not formulaic, it's not he said, she said. So I think health is a very engaging, lively, fascinating topic. And if I'm continuing with it, it's one of my special areas of interest, though it's not the only one. I think it's simply because I enjoy writing about it.
A very strong message is actually coming out of that, is that everything affects health, be it fashion, be it exchange, transport, anything, it affects health. And the best way to sort of talk about is to bring out stories of people in an ethical manner. So that's
empathy.
something.
I think empathy, I've always said journalism is not it's about temperament. It's not about erudition. A lot of people have information. And in fact, I think information is, a lot of people have information. It's the insights, it's empathy. It's not just the ability to string together grammatically correct sentences or to write it in very flowery ways. Style is important, but I don't say this is the most important thing. It's the empathy. The information you get from people will depend on the trust they have in you. Unless you're going into stealing stuff, I'm not talking about that kind of thing. I'm not a scoop person. So the information you get is a directly related to the trust you build. So it's actually not just from a moral and ethical, but even from a strategic, even from a professional viewpoint. I would say building that trust with whoever you interact with when you go to a field. And I think it's vital to go to the field. You can't sit and write on health sitting in your desk and reading books and attending conferences. No, there's a huge, I'm not trashing any of that. You go to conferences, you pick up papers, you talk to experts, but you have to go the extra mile. You have to go to the extent that is possible. So, but the first thing is you have to build a trust. It's only when people trust you, they will talk to you, they will open up about everything. If they don't trust you, they will withhold information. They will not tell you anything. You'll come up with banal or inane stuff which everybody knows. So it's extremely important to, I think, for medical, I think that's what we have in common. Medical doctors, I think, if when you're talking to a patient, if you are very snap, maybe the patient won't even tell you half the things that's wrong with the person, right? I have a great GP, and I think it's that I open up only because I trust her. I know she will not betray my trust. That's extremely important. If I think this person is going to betray my trust, or this person's unsympathetic, during the HIV, again, I learned a lot of medical doctors were very, very, at least these people used to say they were very unsympathetic. They were very judgmental. They were very moralistic. So they didn't, people say that, why should I go and get this voluntary testing done when, this person is just going to make me feel terrible at the end. So I think that's one thing in common between journalists and medical doctors, that the trust building is the first step. Everything follows from that.
So two things have been clearly established in our conversation so far. One is that health is definitely a political issue. And health journalism, even though some might find it not so fascinating and glamorous, is extremely important. And so my final question is going to be that, health is not a political issue as much as it should be in India currently. Can health journalism be a solution to that? And, how can people go about it?
Yeah, I mean, as somebody who writes on health, I would say that I think health can be a political issue. I mean, it is rising in profile. I think the COVID put it. I think it's, again, I will go back to what I said earlier. I think we have to contextualize the health issue, with what people are supposedly interested in, or what people perceive as important issue. Now, I'll give you a simple example. Let's take something which most of us don't see as a health issue: India-China relations. Okay, people, that's usually the topic of people who cover foreign affairs or security, or that kind of thing. But as we know, that every time there's these skirmishes and there's all these calls for, let's boycott China, let's health security comes in. The APIs, the active pharmaceutical ingredients. Now, this is directly, it is a health issue, because your entire pharma industry, India's pharma industry, cannot function without these imports of API, chiefly from China. Now, I myself have written God knows how many pieces, how many columns on various tasks. Well, there have been various initiatives. Maybe things have improved a little bit, but we're still dependent. So an issue, if you want to be, if you talk about health, this is, the medicines you take. If those medicines cannot be produced with, inputs or with imports from another country with whom you have a sticky relationship for other reasons, where are you? So I'm just saying, this is, to my mind, an extremely important issue. Is it a health issue? I don't care what you call it. Is it a health issue? Is it a security issue? Is it a foreign policy issue? Is it a defense issue? I don't care what label you call it. But health is definitely a major part of it, because it links to medicines, it links to the pharma industry, And if it links to medicines, it also links to, people's health, right? So if people, that's why I'm saying that one should be able to link it, like malnutrition. If you say, oh, why do I care if, I when I was doing this book for newborn deaths, so I went around the whole country for UNICEF, including Andaman and Nicobar Islands and all that. And what I found, that even middle class women had no idea about breastfeeding, the correct way of breastfeeding. Now, is this a sectoral issue? No, because everyone wants their child to be healthy, to be, growing up. Now, if you don't know, and this one woman I met, she was a librarian. She had a master's degree, and she said till a local health worker at that time, they were being trained in this IMNCI module, so she had this benefit. But what she said is, till she came along, she had no idea that colostrum was so important, so then you link with, what did the mother-in-law say, what did the mother say. So, and why is it important? Because if you're not going to give breast milk to your child, or if you're going to, or if you're not giving any complementary feeding after 6 months, you're giving, you think there's two extremes, right? The breast milk goes on for 1.5 years without anything else, because the mother wants to show love for the child, not giving anything else. You get a weak child. And then the brain development. Now, if you tell a middle class person, or anybody, everybody wants that child to do well, but you don't handicap them from the beginning. So the dietary diversity, it's not, I've seen so many middle class people, they're giving too much. And even politicians in recent times, you find these absolutely semi-literate, illiterate kind of statements saying we are giving free grain, so why is it that this can't be true? But free grain is not taking care of your entire dietary necessity. These misconceptions and all are very ingrained even among the educated people, right? So why is dietary diversity important? So you have to explain. It needs time. Most people will not, if you do not explain anything to them, they may not, like iron pills, this, right? If you go to villages, you'll find most of the women just chuck away the iron pill. Every drain in every village that I have visited is clogged with iron pills. Kyun? Because they will say ye badbu aata hai, it smells this that. But they don't really realize, the importance. Nobody wants. So I'm saying these things have to be put on the table, explained, not as a kind of do this, do that, not in a dictatorial way, but address. I mean, don't infantilize people, assume that they are intelligent individuals who want the best for themselves and their children, and explain the linkage. If I'm telling you to have dietary diversity, I have enough protein. It is not because I'm, koi baap dada keh rahe hai, or I'm a government person, so you must listen to me. No, because it will eventually. So I think these things have to be explained. And one issue is very important, that we might think this is very important information, is very relevant, everybody should know. But remember, right now we're also living in this social media. People have very little attention span. I mean, everybody would rather, I myself want to watch Pathan and dance, instead of listening to health message. That's normal. Do not, don't come down like a ton of bricks on that. You have to make this interesting. You have to make this interesting. So I think storytelling is very important as a strategy. Get people to tell their stories. You tell their stories. Make it interesting. The packaging, how you package that information, is as important as the information, because nobody is obliged to listen to you. You may think you have something very important to say. I might think health is the most important thing, or I write this column thinking, oh, this is very important. But if somebody picks up this new, they're not obliged to read me. I cannot, I cannot chuck them into jail simply because they don't like my columns or they haven't read my column. I have to make myself interesting. So okay, it's not me. I'm just talking about whether you're in television, whether you're writing, or whether you're blogging, whether you are podcasting. Nobody's obliged to listen to you or pay you any attention. People can switch off if they find you boring. You are competing with diverse things. Maybe fashion, whatever. Films, something else. In that space where information and entertainment is imploding, how do you stand out? How do you make yourself interesting? So
Yeah.
I think that's marketing. Now, so we should not sneer at people emphasizing the importance of why are some people listened to and why are not others, even when the message is the same. It's the same skill. That doesn't mean it's just style, but it's content plus style. So I think these are very important issues, because there is a reality. There's nothing we can do about it. People have attention span. And one last thing is, remember, the vast majority of Indians is below 25. That means there's a lot of stuff which has happened, they don't know about it. So we have, like, when I talk about HIV AIDS, there are a lot of people, was it like this, they have no memory. So I have to be able to put this information in an accessible form, easily digestible form, so that this whole crowd, which is the majority, by the way, and you cannot assume that this person has read lots of books, is interested. No, nothing. Maybe the person is totally disinterested. So that's to take that into account and speak or write or do whatever accordingly. I think this is very important.
So three very key points came out of this discussion, the last bit. One is that health is not as much as a political issue as it should be, because of there's general lack of awareness. There is lack of easy to understand information when it specifically comes to health, which is publicly available, and there is a very poor mode of delivery of whatever information that is there, and which is not addressing the attention span, which is already very
Yeah,
minor.
it has to be in multiple Indian languages, and it
Yeah.
must be jargon free. It must be jargon free. So, like I said, if you say somebody had died of eclampsia, what does that mean? It means nothing. But and that is the reason why a lot of people, like district administrations, want this jargon, because in a way it clouds the real reasons. If I say this person actually died of hemorrhage, or a sepsis, right? Because you didn't have access to thing. There was no road. There was no thing. That it's a whole story of a living, breathing woman who need not have died, but has died. We'd go into the status of women in India in that particular context, the state of infrastructure, the state of healthcare system, and then she died, or maybe her child died, or maybe the child survived, she died. That is a very powerful story, and that's a story they don't want being told, because then there will be reaction. If you reduce it to she died of sepsis, to a lay person reading it,
It
I
makes
will
no
just move
sense. Yeah.
on. It doesn't tell you anything. So
Yeah.
you realize why, while it's extremely, that's also politics.
Yeah.
While we need to tell stories in a very powerful, compelling way, you can also see why very powerfully told stories will not be liked. That explains why a lot of journalists are under attack. The moment you know how to tell, and not just on healthcare, when you tell the stories very well, people will listen and maybe some change can happen. That is obviously not liked by a lot of other people. So, you get why it's political. So,
Yeah.
but we need to tell stories, this is the only way
And
to.
I feel that's where Nivarna steps in, because
Oh,
these are exactly the sort of issues I had in mind, and
yeah.
Nivarna came out to be a solution to these problems. The
Yeah,
way we are
great.
writing is just sort of for the general public, no jargon, and we
Yeah.
are trying to package it well with connecting it with the story. And now with you as an advisor for our team.
Thank you. I don't know. I'm the only, I feel quite semi literate, because I think I'm the only one over here who's not a doctor, a medical
No, there
doctor.
are other non-doctors as well.
Oh, really?
Yeah, there
Not
are.
non MBBS?
Yeah, non-MBBS, there are people.
Oh, oh my God, you allow them. Okay. Allow them
I
in.
No, I wanted the group to be like very, very mixed. And then again, like just because now we have you as an advisor, is just surely going to help us,
Thank you
achieve
so much.
our vision and
Well,
mission
I'll try to help. Yeah.
in the coming time.
No,
So,
I mean, this is kind of important, and I hope today our discussions, again, I mean, I know something about health. You're of course a medical doctor. I hope it was jargon free. I hope it was, I mean, I cannot judge myself how I sounded, but I hope my effort or my intention was to speak in a way which someone who's not even interested in health, or not not particularly, not a doctor, not a health journalist, will
yeah.
also be able to understand largely. I don't know whether I succeeded, but that was my intention at any rate.
Yeah, thanks a lot. We have already spoken for almost an
Yeah.
hour,
Yes,
and
yes, yes, yes.
this discussion was extremely relevant, and it was a need of the hour.
Yeah.
And I feel with this conversation starting now, I think it's sort of I take it as a personal responsibility to take it forward and, sort of address all the issues that you brought up.
Yeah.
So thanks a lot for that.